If we look at the very basic principles of ethics, I mean, the first is what they call beneficence, which is to do good. The second is non-maleficence, which is do not do harm. The third is autonomy, respect the patient's right to self-determination. The fourth is justice, just be fair to everybody. And those are the four cardinal principles that I hold on to. And I think if we focus on those four, and we focus on everybody in the IVF treatment cycle, such as the couple themselves, the baby to be born, and sometimes you need donor eggs or you need surrogates, and you look at all of them and say, are we doing any harm to anybody here? You have to answer that question. And if you're not, fine. Are we doing good? Are we being fair to everybody? This is a challenge when you're talking about people providing donated gametes. For example, a lot of young women are incentivized financially to provide their eggs. How much should the cost of their oocytes be? How do you compensate them adequately to ensure that whatever discomfort they're going through is mitigated? These are all ethical issues. There are no black and white answers in ethics, but the key thing is to take each case on a case-by-case basis, discuss the issues, be clear that you're not doing any harm to anybody, be clear that you're doing good by the service you're providing, be clear that you're respecting their rights to self-determination, be clear that you are being fair to everybody concerned in the treatment. And I think if you go through that and patients are aware of this, then I think it's very difficult to put the service into disrepute. Because sometimes we were so focused on the commissioning couple, you think the surrogate is a commodity to provide eggs and be paid and go away. No, she's a human being who has rights. And are you sure that we've covered all our rights? Or there's a big debate about surrogacy because it's a big ask, having a woman to carry a baby for 9 months and give the baby back. Can you use law of contracts to enforce the right of the commissioning couple to take the baby from the surrogate? I think not, because it could be seen that you're causing harm to the woman. So these are issues. There are no black and white answers, but the idea is just to raise awareness so that people are aware that these issues are there, and we need to be very careful and don't just be one-sided and when we consider couples taking assisted reproduction.